Okay, thank you so much, Emma, for introducing me and for having me here to share some information about rare disease, mental health and wellbeing. So my personal disclosure statement, as Emma said, I'm the Education and Advocacy Manager at Rare Voices Australia. I'm the mum to a young person living with a rare disease, and I have no conflicts of interest or financial disclosures to make. So tonight I'm going to talk about a couple of things about what are some of the unique mental health and wellbeing challenges of rare diseases, how common and severe the mental health challenges might be, and then some top tips for healthcare providers, so things that you might be able to do with families who are living with a rare disease, and then provide some information about resources. So just before I start, a little bit about Rare Voices Australia. Rare Voices is the peak national body, and we're responsible for progressing policy and system change for the benefits of Australians living with a rare disease. As part of that, we led the collaborative development of the National Strategic Action Plan for Rare Disease. So this action plan was developed by the whole sector through some fairly extensive community consultations, and therefore I guess it represents what's important to people living with a rare disease, clinicians, researchers, industry, and it is the Australian government's policy position on rare diseases. The expertise and focus of Rare Voices Australia's policy and system change to address these common challenges faced by the Australian rare disease community. And that was what the action plan was intended to do, is sort of really try and get a sense of what those common challenges are. And RVA works with more than 100 rare disease organisations as partners. So we don't provide direct support, but really our umbrella organisation for the many rare disease support organisations out there. And we also work with researchers, clinicians, government and industry. So a little bit about the Rarest Project for those of you who weren't here to hear about it last year, and you can now go to the webpage and learn lots about it. But as a way of implementing some of the recommendations from the National Strategic Action Plan for Rare Diseases, the government has made a grant, and the Rarest grant is being led by the University of New South Wales, and it's a consortia that includes University of Western Australia, Macquarie University and Rare Voices Australia. And Rare Voices is leading Stream 1, which is the mental health and wellbeing stream. And so the key activities of that stream was to do a landscape review of mental health and wellbeing impacts and resources for people living with a rare disease in Australia, and that's completed. There's also training courses for patient advocacy groups in mental health red flags and referrals, and so that's with Mental Health First Aid Australia. And finally, we'll be looking at digital mental health and wellbeing resources for people living with a rare disease. And those resources, I guess, have been chosen to have an evidence base, but also to be accessible to people living across Australia. So one of the things that we learned from our landscape analysis and from talking to our stakeholder reference group is the importance of being able to access resources from where you are, even if you don't live in a major metro area, but also that often a barrier to accessing supports for rare disease families is the incredibly high burden of care that often goes with rare diseases, meaning there's often not time to go to additional appointments because there's already so many to deal with. So what are some of the mental health challenges that people living with a rare disease can experience? So I think the first thing is to realise it's quite common, and there is a much higher incidence of mental health issues amongst the rare disease community when compared with the general population. And the types of things that the landscape analysis uncovered, but also that we hear at Rare Voices from rare disease communities is about anxiety, stress, low mood and emotional exhaustion. And one of the things I think is particularly important to understand is that it's not just the person who is diagnosed with the rare condition that will be impacted. Family members, loved ones, carers and supporters are also quite significantly affected as well. And the types of things that contribute to some of these mental health impacts are feeling isolated. So, the experience of having a rare disease can be quite isolating. Often you will hear from people that they've never met anyone else with the same condition as them. Because the burden of care associated with the condition can be high, families can become quite isolated just coping with the daily management of a condition. Misdiagnosis is common, and the challenge of getting the right diagnosis is also a problem. And we know that there's some pretty good evidence showing that it can take up to 5 years for a rare disease to be diagnosed. And during that time, people often report not being taken seriously by healthcare professionals and feeling dismissed. There is quite a lack of treatment options. Only about 6% of rare diseases have a definitive treatment option, and poor care coordination. These are all some of the things that can contribute to that stress and poorer mental health outcomes of people living with a rare disease. And so there's some additional ones, and these are ones when we were developing the National Strategic Action Plan for Rare Diseases, things that people told us were problems. So the high burden of care is definitely a challenge for many families, and because there are so few treatment options available, a lot of what happens is symptom management, and that can take quite a lot of burden on families. People report a devastating loss of hope when a treatment doesn't work out, or commonly a clinical trial is stopped, because often for rare diseases, because there are so few treatments available, a clinical trial might be the only way people have access to a treatment. And when that clinical trial, in which a lot of hope has been invested, is stopped, that can be quite devastating for families. Families talk a lot about grief, and I suppose there's the grief where a condition is life-limiting, but also anticipatory grief when disease progresses suddenly, or symptoms emerge that you mightn't have been aware of, or new evidence about the condition becomes clear. I've spoken about the feelings of isolation and loneliness that people feel, and the diagnostic delay, which is a really challenging thing for many rare disease families. And then often they pin their hope on diagnosis, but when a diagnosis comes, there's still not necessarily a clear treatment pathway. And the other thing I think that goes with that long diagnostic odyssey is, once you get a diagnosis, often you'll go to a healthcare professional and realize that you know quite a lot more about the rare disease than they do. So what we see is rare disease families being the educators of healthcare professionals at the same time as they are learning about a rare disease. So the other thing, as I said, is that rare disease diagnosis impacts on the whole family. And so parents and carers report anxiety and confusion, and even more than those with chronic illnesses. So often people will say to me, oh, well, the mental health impacts would be similar to a chronic and complex condition, and they are similar, but because of those unique features, there are often additional impacts. Families of children with rare diseases report strong feelings of fear, uncertainty, and worry for the future of their child. And I think that's to be expected. And so one of the things that struck me as we did the landscape analysis and looked at the research, and it's not that surprising to me as a rare disease parent, is that it's not that surprising really that people have mental health impacts, because you can see there's a lot of factors, environmental factors, that contribute to that. And finally, siblings are also significantly impacted with child and parent relationships and child and parent communication. And the types of things that siblings might experience is that feeling that most of the attention, time, and energy is absorbed in caring for a child who has a rare condition. So despite quite a lot of evidence showing that the mental health and wellbeing impacts of rare disease are quite significant, most patients are reporting that they're not receiving adequate support for these. So a survey, these are both Australian surveys, 20.6 participants stated that they had received adequate psychological support for their rare disease. Another Australian study, the families reported that the psychological impact was moderate to high, and that was interesting because that was regardless of disease, of symptom severity, but very few families had been offered psychological support. So I think you can see from that there is a big gap in care, but some of the gaps could be addressed in a fairly straightforward way. So what are some of the tips for healthcare providers that you can, I guess, that you can use? I think the very first one is to routinely ask about mental health and wellbeing for not just the person living with the rare disease, but their carers and family members at appointments, and also to help reduce the stigma by normalising how common the impacts are. As I said, I think it's quite predictable in some ways that these families are at high risk of experiencing mental distress. So speaking about it early and often and asking how people are going is a really useful thing and simple thing that most people can do. I think the second thing is to address practical support needs. As we discussed, the burden of care is quite high. So providing information about things like the Carer Gateway, Siblings Australia, and other services that provide support for carers and family members so that they can get access to practical support, but also social support. And it's quite clear that some of that social support can help break those feelings of isolation and loneliness that we discussed earlier. Other things you can do: discuss strategies for maintaining mental wellbeing through focusing on a strengths-based approach. And I'll talk a little bit more about the strengths-based approach in the next slide. Practice shared decision-making and partnership with families. So quite a lot of the research and again, my own lived experience is that one of the things that is really difficult when you get a diagnosis of a rare disease is how much uncertainty there is, how many unknowns there are. And what it seems to be is that people look for opportunities to feel like they're in control, to have some sense of empowerment or power in a situation in which they feel quite powerless a lot of the time. So even things like participating in research, but also being part of shared decision making and being treated as a team member with the healthcare team are all things that seem to have a positive impact on people's mental health and wellbeing. And finally, linking with disease-specific rare disease organisations where that's possible is also really beneficial. And again, there's quite a bit of research showing the benefits of the social support that can come from shared experience that helps to break that sense of isolation that families often feel. So I mentioned a strengths-based approach, and I wanted to specifically speak about this because I think that healthcare, one, it tends to focus on a disorder, but also I think when you have a child with a rare disease or with many rare diseases, a lot of the things you're talking about are deficits. So a strengths-based approach is about considering the whole person in their family and shifting the focus onto what is working well, what the person does best, what the family does well, what resources they have available to help them deal more effectively with the healthcare challenge. And I guess it's that thing, and I often think about this, it's focusing more on what people are than what they're not. And it's a really helpful way to foster person-centred care. And finally, social and emotional wellbeing for Aboriginal and Torres Strait Islander communities is an important consideration. The National Strategic Action Plan recognises that Aboriginal and Torres Strait Islander people are living with rare diseases as a priority population, and healthcare professionals should therefore access cultural safety training and also refer to specific culturally safe resources when recommending mental health resources for Aboriginal and Torres Strait Islander people. And health and wellbeing combines the mental, physical, cultural and spiritual health of the individual as well as the whole community. So just a reminder to think about those things. So I guess if you would like to learn more, I really would like to encourage you to do the Rare Disease 101 module on mental health and wellbeing. It's live now, ready to go. There's the link down there, and in there that that resource covers some of the information that we've talked about today, but provides information about referrals pathways like Siblings Australia, the Carer Gateway, and other support services that are very useful to families who are living with a rare disease and to help them deal with their diagnosis and the impacts on the whole family. So I guess to summarise, person-centred care enables better emotional and psychological well-being. And as I said, the person-centred care allows that person or family members to feel some control in an environment where there are so many unknowns and uncertainties that it's really difficult to find something. And participating in healthcare and making decisions is a way to feel empowered. Many people who are living with a rare disease feel that there is stigma or social exclusion or misconception, and this can be for both obvious diseases but also some of those invisible rare diseases where people may not be able to look at a person and realise they've got a condition and therefore may not take into account some of their challenges. And learning about how a rare disease impacts on people's lives can help you to build rapport with your patient and support them more effectively. Thank you.